Hello, welcome to our Tuesday Facebook Live video. Today we are going to continue celebrating National Physical Therapy Month this October 2018, and we are going to specifically talk about how do physical therapists do what they do. I'm Dr. Jeanette DeWitt, and I am a physical therapist. I'm a certified athletic trainer as well as a certified personal trainer and fitness coach. Today, like I said, we are going to talk about how physical therapists do what we do. And when I say that, how do we do what we do? What do we utilize to help people move better and feel better? That's basically what I'm going to chat about today. There's a lot of different options that I have as a physical therapist. For example, I can actually use modalities. What is a modality? Well, it's a tool or it's a machine that I might use to help people get rid of inflammation, improve their range of motion, get rid of their pain. For example, ice and heat are considered modalities. If somebody has an initial injury, I'm going to apply ice to help with swelling, to help decrease pain, to help decrease muscle spasm, and help basically prevent tissues surrounding the actual injured area from also becoming injured. For heat, if somebody has dull, achy soreness, if their injury has been going on for a while and there's not inflammation or swelling present, then I may apply heat to relax the muscles in the area, to help increase circulation to the area, to help bring healing, and also just ease any muscle tension that might be in the area. Other modalities that I can use are electrical stimulation. Now, a lot of people have heard of electrical stimulation called TENS. TENS is transcutaneous electrical stimulation. TENS is an option that a lot of people use to help with pain. But TENS is not the only option of electrical stimulation. There are multiple different forms of electrical stimulation which can decrease pain, decrease inflammation, and make treatment just more tolerable, especially if someone is after an injury or has chronic pain. And it's a great way to utilize or decrease pain without utilizing medication. Another modality is ultrasound. And ultrasound can be used to heat an area, but it can also be used for non-heating or non-thermal properties. So an example of that would be if somebody has a tendonitis issue, I might use non-thermal ultrasound to help restore some healing to the area. If somebody has a muscle spasm, I might choose to use thermal ultrasound or deep heat to help relax that area by increasing blood flow to the area. So these are some modalities that I can use in the office: ice, heat, ultrasound, and electrical stimulation. But those aren't the only things that I can do. They're not the only tools in my toolbox. I can also use hands-on therapy. Hands-on therapy, manual therapy, where I take my hands and I use them to help relieve muscle tension. I can help ease muscle soreness. I can also use my hands to reduce scar tissue in the area and scar adhesions that have occurred if somebody has had surgery and they haven't been able to move their body part. For example, if somebody has shoulder surgery, there are certain guidelines that us physical therapists have to abide by to protect the repair that the surgeon did. So as the person is restricted in using or going through a range of motion because that would hurt the repair that they had, I can use my hands to help to move their shoulder blade so their shoulder blade doesn't get stiff, but I can also use my hands to reduce any neck soreness that might be occurring from the sling, and I can reduce their muscle tension from the weight of their arm. So that would be an example that I might use manual therapy after a surgery. The other thing that I can do is if somebody has chronic pain, has chronic spasming in their low back, I can use my hands to work out some of those spasms and trigger points. And I always like to say a trigger point is a shortened area of the muscle that does not let the muscle contract properly and does not let the muscle stretch properly. And it requires a physical intervention from a physical therapist or a massage therapist to reduce the presence of the trigger point. An easy way to look at that is if my hands are like this and I have a trigger point, now my hands are knotted up. The manual therapy is going to push down and apply pressure to kind of melt that trigger point away. And now you have a normal length of a tissue again. I specifically can do mobilizations of joints, which what that is if a capsule of a joint is kind of stuck, or if the joint itself is not moving properly, then I can take my hands to that joint and actually move it and create movement. This type of mobilization has 5 different levels to it. So it can be very gentle, or it can be kind of a quick thrust type movement that can cause a pop in that movement when I'm moving that segment or that bony joint. This is different than a chiropractor. A chiropractor does an adjustment, it's a quick movement, but a quick velocity or a high velocity quick mobilization is considered a grade 5, and you may or may not get popping with it. The popping does not mean that it's effective, and if there's no popping, it doesn't mean that the mobilization was not effective. So just the popping sound is what we call just air in the joint being released and a movement in that joint that's being created. A small amount of mobilization is just usually within the first 25% of that joint's mobility. For example, somebody who had surgery, you don't want to put a ton of mobility in there if they had surgery to correct mobility. However, you want to restore mobility as you are allowed to do that following the surgery. So there's our examples of joint mobilizations. Now, I'm also certified in precision neuromuscular therapy, and precision neuromuscular therapy is a very specific type of medical massage. And I can use those techniques through positioning, stretching of tissue, elongating of tissue, mobilizing soft tissue, whether it's muscle or ligament or fascia, which is kind of the connective tissue that keeps everything together. I can utilize precision neuromuscular therapy, also known as PNMT, to reduce muscle spasms, to create mobility, and to ease pain. The other thing that I can do with hands-on therapy is create positions for the person and teach them techniques to do so that they can do some self techniques at home. And that might be with their hands, that might be with tools like a running stick, which is a flexible stick to help do self-massage techniques with, a foam roller, or a tennis ball. These would be all teaching techniques I could use to teach people how to help themselves at home. Another thing that physical therapists really specialize in are therapeutic exercises. This is where I can take positions or specific exercises and prescribe them for a person who's coming in to relieve their pain, to restore motion, to increase strength, to increase endurance, and basically get them back to doing the things they want to be able to do. The key about therapeutic exercise is that knowing the right exercise for the right person at the right time. So if somebody's just coming back from a knee injury, it would be wrong to have them do a bunch of jumping activities. That's the right exercise at the wrong time for the wrong person. However, giving them an exercise to help bend their knee to get their motion back would be very appropriate. That would be an exercise prescribed for the right person at the right time, and it's the right exercise. So different exercises mean different things for different patients or people at different times. And it's the job of the physical therapist to prescribe the exercise correctly. Now, another thing that physical therapists do is create fun activities. For example, if you're an athlete and you want to get back to playing basketball, you need to have a basketball in your hand as soon as possible. Maybe you had a knee injury. Well, we can do exercises with you sitting in a chair, bouncing a ball with your hands to keep your arm strength while you're also working on your core while you're sitting. So we can do abdominal exercises sitting while you're bouncing a ball, and then we can incorporate seated exercises for your knee as you're coming back to help with strength. So there's a host of activities we can do to make it fun for your sport. If you don't play a sport, but you want to be able to get down on the floor to play with your kids, or you want to get down on the floor to play with your grandkids, we can actually create activities that will help you get up and down off the floor. We'll first work on strength, and then we'll make sure that you have arm strength to be able to push up off the floor. We'll make sure that you have hip and knee mobility to be able to get into the position of kneeling and coming up off the floor. And then we'll also work on strength, maybe through squats or lunging, to be able to push through your leg to stand up from the floor. So there's all these little exercises that we can do so that you can accomplish the task of getting up and down off the floor and playing with your kids. With, let's say you're a caregiver and you have an elderly parent who needs care and they need help. They need your help to get in and out of bed. We can help the elderly parent improve their strength and their balance, but we can also help you by teaching you ways to protect yourself when you're helping to transfer them or help them get in and out of a chair, help them get in and out of the bed. We can teach you techniques so you don't hurt your back or strain your muscles trying to help someone else. Another example would be if you're an office worker. We can help you develop a workstation so that it's not stressful and straining on your muscles to be sitting at a computer all day. We can teach you stretch breaks and posture breaks. We can teach you how to set up your computer station and the level of the eye monitor or the level of the monitor to be at the level of your eyes. We can teach you how to use the keyboard and how to set up your chair in relationship to the keyboard. So there's a lot of activities that physical therapists can do, whether it's sports specific, whether it's being a parent, whether it's being a caregiver or an office worker. These are all things that therapists can help with to make sure that you are performing at your best. Now, beyond physical therapy, physical therapists can help through the whole life spectrum. We can help prevent injuries by teaching good exercise to keep people strong so injuries don't happen. We can teach exercises during the rehabilitation process so that the pain is down, the motion is coming back, the strength is coming back, the endurance is coming back so that you can get back to doing what you want to do. And we can also help you maintain a healthy lifestyle and maintain good overall fitness. We're happy to help you throughout this entire spectrum, whether it's preventing injuries, whether it's helping you heal during an injury, or helping you keep healthy and prevent a re-injury from occurring by maintaining your fitness. We can help with your fitness goals, we can help with your weight management goals, and we can do a lot more based on the goals you have for yourself in your healthy lifestyle. When you share what you want for your overall wellness, we can share what we know to help you get there. For more information about physical therapy that might be specific to you, whether it fits into a prevention program, whether it fits into an actual rehabilitation program, or whether it fits into more of a fitness program, please don't hesitate to contact me at 262-842-2220, or just email me directly at Jeanette@DeWittPTWellness.com. Thank you so much and have a great day.